The silent threat. Understanding the growing impact of bird flu on feline companions. A disturbing trend is emerging in the world of veterinary medicine as cats across the United States face an unprecedented challenge: the spread of highly pathogenic avian influenza, commonly known as bird flu. This development has raised serious concerns among veterinarians, public health experts, and pet owners alike, as the disease presents with severe symptoms and has shown an alarming mortality rate among infected felines. The recent outbreak has affected cats in various environments, from farm settings to wildlife sanctuaries, and even indoor pets. Perhaps most concerning is the case of 20 wild cats at a Washington state animal sanctuary, where the outbreak highlighted the virus's ability to spread rapidly through feline populations. These cases have brought to light the complex relationship between cats' natural behaviors and their susceptibility to this dangerous pathogen. Understanding the transmission pattern. The relationship between cats and bird flu stems from their fundamental nature as predators. Unlike many other domestic pets, cats maintain strong hunting instincts that drive them to pursue and consume smaller prey, particularly birds and rodents. This behavioral characteristic, while natural, has become a significant factor in their exposure to the H5N1 virus. Dr. Michael Bailey, the president-elect of the American Veterinary Medical Association, AVMA, emphasizes that cats' exposure to the virus isn't necessarily due to increased susceptibility, but rather their higher likelihood of encountering infected prey. The history of feline susceptibility to bird flu dates back to 2004, when domestic cats were first documented carrying the virus. However, the current outbreak in the United States presents particularly troubling statistics. According to Kristen Coleman, an assistant professor at the University of Maryland School of Public Health, the mortality rate has increased dramatically. While previous outbreaks saw approximately 50% of infected cats succumbing to the disease, the current strain, which has been observed spreading among cattle, has pushed the mortality rate to around 90%. Recognizing the signs. The manifestation of bird flu in cats can be both rapid and severe. Pet owners need to be vigilant for a range of symptoms that can indicate infection. Early signs often include basic indicators of illness, such as decreased appetite and lethargy, accompanied by fever. However, the disease can quickly progress to cause severe neurological complications. Affected cats may exhibit tremors, seizures, and coordination problems, with some cases resulting in blindness. Respiratory symptoms are another crucial indicator, with infected cats showing signs of labored breathing, sneezing, and coughing. Many also develop noticeable discharge from their eyes and nose. Perhaps most striking is the severe depression that can accompany infection, marking a dramatic change in the cat's normal behavior and demeanor. The risk to indoor cats. While outdoor cats face the highest risk of exposure, indoor cats are not entirely safe from the threat of bird flu. One significant risk factor for indoor cats comes from the growing trend of raw food diets. The AVMA has taken a strong stance against feeding pets raw or undercooked animal products, as these can harbor active virus particles. The solution is straightforward. Ensuring all meat is thoroughly cooked and milk is properly pasteurized effectively neutralizes the virus. Even in indoor environments, cats may encounter potential carriers of the virus, particularly mice that find their way into homes. While cats are often praised for their role in pest control, this natural behavior could now pose a serious health risk if the rodents they encounter are infected with bird flu. Protective measures for outdoor cats. For cats that spend time outdoors, the risks are significantly higher. These cats may encounter dead animals, wild birds, or mice carrying the virus, making it crucial for owners to take preventive measures. Health experts strongly recommend limiting outdoor time for cats and being particularly vigilant about preventing them from consuming dead animals or bringing potential carriers into the home. The public health implications. The broader implications of cats contracting bird flu extend beyond individual pet health. Cats possess a unique characteristic that makes them particularly concerning from a public health perspective: their ability to contract both avian and human influenza viruses. This dual susceptibility means cats could potentially serve as mixing vessels, where different strains of influenza could combine to create new variants. A study published in December highlighted this concern, pointing out the possibility of new strains emerging that could more easily infect humans. Current surveillance of the situation in the United States has revealed that more than 60 people have contracted bird flu, primarily through contact with dairy or poultry farms. While human-to-human transmission hasn't been documented, the potential role of cats in the virus's evolution adds another layer of complexity to the situation. Suresh Kuchipudi, a professor and chair of infectious diseases at the University of Pittsburgh School of Public Health, argues that cats should be prioritized in surveillance efforts, given their potential role in the virus's spread and evolution. Protective measures and best practices. The AVMA has outlined several key practices for protecting both cats and their human families. These include maintaining strict hygiene protocols, such as thorough hand washing after handling cats or cleaning their living areas. For households with potentially infected cats, limiting contact between the sick animal and other pets or family members is crucial, with particular attention paid to protecting immunocompromised individuals. The Centers for Disease Control and Prevention, CDC, advises monitoring for flu-like symptoms in both cats and humans when exposure is suspected. While the risk of cats transmitting H5N1 to humans is considered extremely low, it isn't zero, making precautionary measures important. Looking ahead. The broader impact. The current situation with cats and bird flu highlights the interconnected nature of animal and human health. As Coleman pointedly states, if us humans don't care for our animals, it's probably not going to end well for us. This perspective emphasizes the importance of taking a comprehensive approach to managing the spread of bird flu, considering not just immediate health risks, but also the potential for long-term consequences. The surveillance gap in monitoring pet infections, particularly compared to livestock and human cases, represents a significant challenge in understanding and controlling the spread of the virus. Improving monitoring systems and developing more effective preventive measures will be crucial in protecting both animal and human health. Understanding the risk to other pets. While cats have shown particular vulnerability to the current strain of bird flu, other pets, including dogs, appear to be less susceptible. According to the Food and Drug Administration, no cases of bird flu have been detected in dogs in the United States. However, the same precautionary measures recommended for cats are advised for dogs, highlighting the importance of comprehensive protection for all pets. Conclusion: the emergence of bird flu as a significant threat to cats represents a complex challenge at the intersection of veterinary medicine, public health, and pet care. The high mortality rate among infected cats, combined with their potential role in viral evolution, makes this situation particularly concerning. Moving forward, increased surveillance, continued research, and widespread adoption of preventive measures will be crucial in protecting both feline and human health. For pet owners, the situation calls for heightened awareness and proactive protection of their feline companions, whether they live indoors or outdoors. Understanding the risks and implementing appropriate preventive measures can help ensure the safety of both pets and their human families in the face of this evolving threat. As we continue to learn more about the virus and its impact on cats, the importance of maintaining vigilant protection and monitoring becomes increasingly clear.